Welcome back to the Mid-Modern Eye Care YouTube channel. Today we're going to be discussing a little bit more about dry eye. So there's a couple of types of dry eye. I break dry eye down into three main categories. There's bacterial dry eye that we'll cover more in a separate video. There is dry eye where your body does not make enough tears. That's a very small subset of dry eye. And then the dry eye that most of us struggle with is basically what I call obstruction dry eye. So it's where oil glands in our eyelids don't produce the oil that they're supposed to. The oil glands producing oil is really critical because it's the oil part of our tears that keeps our eyes from drying out. Otherwise, if the oil's not on the front surface of our eye, our tears dry out too quickly. They evaporate off the front of our eyes very, very quickly. So getting the oil glands producing good oil is absolutely key to most dry eye patients. I do dry eye treatments basically broken down into three main parts. So we need to reduce the inflammation that caused the oil glands to be plugged in the first place. We do that with a procedure called IPL, that stands for intense pulsed light. And then that procedure is coupled with a procedure called Masking procedure. What the Masking procedure is, that is basically where we open the tops of the oil glands again. We don't do it with a scalpel, we don't do it with a needle or anything like that. It's a very specialized small little filament that we use because the oil glands are very delicate. They're fairly delicate and they're very, very, very small. The third part is after we have opened the oil glands up, after we have reduced the inflammation from the oil glands, then we also need to get the old nasty oil out of those oil glands. And we do that with a thermal lid treatment. There's a lot of various types of thermal lid treatments out there. What I use has a little device that heats up these little stickers that they stick on a patient's eyelids. These stickers are very expensive. That's most of the cost of the procedure, actually. These run hundreds of dollars, actually. So I'm going to set one of these aside, and we're just going to work with this one here. What we do here, these little pads, those are adhesive. So we have the patient close their eyes and we stick one pad on their upper eyelid and one of the stickers on their lower eyelid, and then we plug them into a device that for about 15 minutes provides a very controlled and very specific heat to the eyelids. I've had this done on me. Patients that have had it done say it feels really pleasant. I actually think it feels really pleasant. After the 15 minutes of warming the eyelids up and warming the oil glands up, we'll very gently work on kind of squeezing the old oil out of the oil glands. It's a little bit akin to melting butter. So we warm the oil glands up, the butter kind of melts and softens, and then we can get it out of the oil gland. A couple of things to be careful with this treatment. Occasionally, when we get the old oil out, occasionally a patient's eyes might feel scratchy or maybe even burn a little bit. I've had this happen to me once. My eyes burned slightly. They felt kind of more dry for a couple of days. And that's just because we've got the old oil out. The body needs some time to get those oil glands flowing again and get them producing better oil. And so it takes some time for that to catch up. So that's one caution I do have for patients. After this treatment, occasionally your eyes might almost feel more irritated afterwards. That's actually pretty rare. Most of the time patients say that this feels absolutely wonderful. Frequent question is, how often do we repeat this procedure? That really depends patient to patient. Because the consumables, basically this part of the procedure, because those are pretty expensive, the procedure itself is fairly expensive. And so some of it depends on, how much a patient wants to spend. It's not something that's covered by insurances. And then also how severe a patient's dry eye is. And do they have another type of dry eye? Do they have some bacterial dry eye in conjunction with the obstructive dry eye? Most of the time, this is something that patients need done maybe once a year, maybe every couple of years, but everybody's a little bit different. If you have any questions about this procedure or any of the other ones we provide here at Mid-Modern Eye Care, please feel free to reach out to us at the clinic, or you can leave a comment below. Again, if you are not one of our patients and you found this video, I hope you found it helpful. Also, please find a provider in your area that is a good dry eye care provider, and get a full, thorough workup to find out exactly what is causing your symptoms. If we can be of service for you here at Mid-Modern Eye Care, please don't hesitate to reach out. And again, remember, we have two eyes and one of them is not just a backup. Stay safe out there. We'll see you in the next one.